So I'm here with Professor Kingsley Faulkner, who spoke on a panel about climate change and health today, and he's here on behalf of the Doctors for the Environment Australia. Can you tell us a little bit about, with such a huge conversation that was had, but I guess some of the topics that were discussed on the panel?
Well, the main discussion was around not only the magnitude of climate change problem, but the urgency of doing something effective about it. There's a general appreciation across the population that it's a problem, but the big problem is to convince them that action is required, and it's required now, not put off for 10 years or 5 years, that people must really make changes right now. They can make those changes as individuals, but unless there's policy change at the federal level and at state level, but mainly the federal level, to transition to renewable energy technologies much more rapidly than currently is happening, then we will fail. And the evidence given on this panel today showed just how serious the rising temperatures are, atmospheric and also oceanic, the impact they're having, and the predisposition that will mean for heat stroke, for more bushfires, more droughts, more heat waves, more floods, possibly more serious cyclones, maybe not more frequent, but more powerful cyclones, more loss of agricultural production, more days above 35 degrees centigrade that people will have to suffer with the consequences of that. Young people potentially dying in active pursuits like sporting events and army exercises and even outback walking, as has happened in recent times. People die from heat effects. Those effects will become more serious, more frequent, and deaths will happen as a consequence. This is not a simple problem, but it is a desperately urgent problem. The scientists are saying we cannot delay any longer. We're already committed to a temperature rise no matter what we did now, and the consequences of that temperature rise, they're telling us, are going to be far more dramatic than people realise. One of the consequences, of course, will be that low-lying nations of the Pacific and Bangladesh will be impacted terribly, and in a populous country like Bangladesh, environmental migration, environmental refugees will be a real concern. The countries of the world that are causing the least emissions, like parts of sub-Saharan Africa, are the ones suffering most at the moment. But even rich countries like the United States has just gone through, California, of course, has just gone through this terrible fire, essentially incinerating the town of Paradise. The east coast of the United States, the southern coast of the United States have been hit by multiple cyclones, and hurricanes they call them. Central America likewise. The typhoons that affected Philippines, causing large loss of life. Those events, unfortunately, are predicted to become more frequent as our oceans rise. The other really concerning problem is the loss of biodiversity and species, disappearance of species. And the prediction, even with 1.5 degrees centigrade rise above pre-industrial times, the prediction is that 70% or so of the Great Barrier Reef will wither. It's already dying. If it gets up to 2 degrees centigrade rise above pre-industrial times, 99% may die. That's one of the 7 natural wonders of the world. Australia has jurisdiction over it, and we're risking it by doing far too little. This country can do much more than it's doing so far. It's shown that it could lead in tobacco control legislation. It's shown it could lead in seatbelt legislation, in blood alcohol legislation and drink driving, and in gun control legislation. This country can punch above its weight. It has enormous natural resources of sun and wind and wave. We could power Asia. We have the brains to do it. We have the technological ability to do it. What's required is government policy to generate the will and the investment to make it happen. Thank you.
Why is this an issue for doctors and what can they do? That was the big focus of the talk today.
Yeah. Well, doctors are trained in the scientific method and they're dealing with people's health. And some of these consequences of climate change directly impact upon people's health. From catastrophic events like bushfires and heat waves and floods and drought, but more subtly by loss of agricultural production, by forcing people to have to work outside in hot conditions and potentially not able to do so. There'll be loss of productivity if temperatures continue to rise. Outdoor workers, farmers, construction workers and many others that have to work outside will be constrained more than they currently are. And the most vulnerable will be the young, the very young, and the old and the disabled. In the bushfire, the Black Saturday bushfires of heat waves of Victoria of 2009, more people died from the effects of the heat wave, than died the 173 that died from the fire itself. Those statistics will get worse unless we get on top of climate change. In California, that fire was the worst in Californian history. It essentially converted part of California into crematorium. Those conditions, unfortunately, will become more common, and the consequences of fires of that nature presumably will become more frequent. We must act, and we must act without any further delay. This is too big an issue to delay driving down emissions. The scientists say that we must drive them down much faster than we're currently doing, and unfortunately current federal policy is not to do that as fast as it should be. It has to change. The health of our community will suffer if it doesn't, and if we're serious about, or governments are serious about looking after the welfare of their community. They talk a lot about the security of the community, but they must look after the health of the community as well. And if they don't get on top of this climate change problem and related matters, they will fail the community, and they don't deserve to govern if that's the case.
And what role can and do doctors have in this?
Well, doctors can talk to one another to make sure that the whole profession realises how serious this is. You can talk to our patients. We can advocate to policymakers in health departments, and we can certainly lobby politicians. My role as chair of the Doctors for the Environment Australia, one of our roles is to try and inform politicians to get them to realise just how serious this problem is and to enact policy changes to address it.
You've mentioned that you have a report coming out very soon, in fact, No Time for Games. Could you talk about that?
In 2015 we produced a publication along with Professor Fiona Stanley called No Time for Games. It was an analysis of the impacts of climate change on the health, particularly of children. We have revamped that document, and we're mobilising or running out a public appeal, if you like, to the profession to get behind making a pledge to do far more than currently is happening, a pledge to look at climate change, the impact on children, and do what they can within their own professional bodies to address the issues before them.
Where do you perceive the health profession as being at with this issue?
Like any group in the society, there are skeptics, climate skeptics in our profession. The AMA survey revealed that was the case. Probably 30% either had scepticism about climate change, or more particularly didn't want the AMA involved in what they regard as a fringe issue. They said that wasn't their core business. Our answer to that is this is core business. Peter Doherty, a former Nobel Prize winner in medicine, said that doctors have a duty of care to individual patients, and they have a duty of care to the determinants of health. And one of the big determinants of health is environmental conditions, and the biggest one of all at the moment is climate change and what that is doing. So we have a responsibility as doctors, not only to individual patients, but to inform the public and to try to influence public policy to address this very, very serious problem.
There was a discussion, I suppose, about what within the health system can be done as well to mitigate against this. What were your thoughts on some of the suggestions?
Within the health system itself, well, we can certainly advocate for driving down the carbon footprint of our hospitals. Dr. David Pension, who was a former director of the Sustainable Development Unit of the NHS in the United Kingdom, was over in Australia recently, speaking in various bodies, including to our own health department. They were able to drive down the carbon footprint of the health system in Britain 11%. In Britain, it was mandated that the health system, the NHS, drive it down to 10% or better. So they did that, and they proved that it could be done with cost advantage. They could save the system money by driving down the carbon footprint, by looking at sustainable use of materials and procurement and the whole lot of the way we get to work, the way we do our business of running a health system. So we can do that. We can certainly collaborate as medical groups with one another, as we are doing at this conference. We've had speakers from the Australian College of Emergency Medicine. I personally come from the College of Surgeons. We had the representative from the AMA and others at the meeting today. So the profession needs to be more cohesive in its messaging, needs to get its message out more strongly than it's done in the past, and really drive home the message that this is not only a massive problem, but it's an urgent problem. And we cannot delay longer. The projections are, if the temperatures continue to rise, that this planet is at risk over time of becoming virtually uninhabitable. It is that serious. We're already losing species. Biodiversity loss is a huge problem. The scientists are telling us that. We can't ignore that. And many of those species may well have potential importance for medicine, as did the penicillin fungus in the first place. So there are lots of things that are happening at the moment to our planet. We were born into a beautiful world, and we are unfortunately doing things at the moment as a species, as a humankind, to make our world far less attractive in terms of the temperature that we live in, the loss of biodiversity, and all the consequences of floods and droughts and famine and all the rest of it. The countries in the world that are most affected, like sub-Saharan Africa and elsewhere like that, are the ones at the moment causing least emissions. Countries like Australia may not contribute a massive amount of emissions, but per capita we are the worst in the world. And if we continue to mine coal and mine or extract gas and petroleum products, that will add to the global burden of emissions. This country ought to be using its natural resources to develop renewable energy technologies as fast as possible. If we did that, we would have the potential to power Asia. There's much radiation falling on our country, and wind and wave. We could potentially make a huge contribution to the powering not only of our own country, but of those countries in our vicinity.
You have a long history in the fight for tobacco control. What parallels do you see between that and you didn't recommend people read Merchants of Doubt today?
Yes, we asked them to read a book called Merchants of Doubt. It showed just how people who are controlling large amounts of money, as the tobacco industry did, or still does, could employ scientists, in this case physicists, to try and muddy the evidence about tobacco and its impact on health. They did it pretty successfully for some considerable time, until eventually people realised that tobacco was a huge health consequence, health risk, and we now know that 2/3 of regular smokers will die from diseases caused by tobacco. The very same people that were used to try and muddy the water about the evidence to do with tobacco were used by the fossil fuel industries to muddy the science about the impact of fossil fuels on climate change. These massively wealthy industries have huge leverage, financial leverage and political leverage. They can sway governments to bring in policies that do far too little on climate change and the reasons why it's happening. And the majority of the reasons why it's happening that we can do something about are the burden of emissions, global greenhouse gas emissions, particularly carbon dioxide and methane, but other pollutants in the atmosphere. We can do something about it. The scientists tell us within the laws of chemistry and physics, if we had the political will, we could tackle this. But unless we have the political will, then we are condemning future generations to a world far less attractive than the ones that I grew up in. Yeah.
So the final question, should we be hopeful or sceptical? That was a question that was tossed around today.
Should we be hopeful or sceptical? Australia has proven that it can punch above its weight in terms of tobacco control legislation, in gun control legislation, in seatbelt legislation in driving vehicles, and in blood alcohol levels in driving vehicles. It can lead the world. It has led the world. We can do the same in climate change if we're serious. We have the scientists and the intellect of this country to do so. It just requires collaboration amongst the people who know enough about it to get the message out, and eventually the politicians to listen, to mobilise the population, to force the politicians to listen, to make it a real electoral issue, as was the case in the recent Wentworth by-election. Dr. Karen Phelps ran on that in that by-election, making climate change as a major plank of her push for the seat, and she won the seat. No matter how much huffing and puffing the government says about it, climate change was a factor for that electoral victory in her part and electoral loss on their part. And yet, at the moment, they are still retreating and refusing to do enough about it. The Prime Minister went to the drought-affected parts of New South Wales and I think Queensland, saying that they're going to help the drought-affected people, but didn't want to talk about climate change as a major issue. When President Trump visited California, he refused to say climate change was part of the problem. When he visited the flood-ravaged areas of his country after hurricanes, he said that wasn't the issue. It is the issue. It is time to have this nonsense stopped. It is time for us to act.
Well, it's going to be a big year ahead.